All right. Welcome everyone to a session in our Parent Empowerment Conference from the Family Support Center. My name is Marcy Torshen. I'm the Assistant Supervisor for the Instructional Supports Assessment and Accommodations Office, where the Family Support Center is. And I have with me Dr. Beth Hare, who's our Instructional Specialist in the Family Support Center, Angela Salmaron, who is our bilingual parent liaison, and Miss Yvette Young is also logging in, and she is our social worker. We are excited to welcome Jacky Edry. I'm going to tell you a little bit about her, and then I'm going to turn the session over to her. She published her first book, Moving Forward, Reflections on Autism, Neurodiversity, Brain Surgery, and Faith in 2021. And shortly after that, she launched her blog. She enjoys consulting and teaching about neurodiversity and sensory processing to a wide range of audiences. She is a Hampshire College graduate with many years of experience in education, writing, lecturing, and marketing. She's been exploring the world of autism and neurodiversity for close to 40 years. Jacky is also neurodivergent and a survivor of complex brain surgery, which greatly affected her sensory and perceptual abilities. Her children have been diagnosed with varying forms of neurodivergence, including autism, ADHD, auditory and sensory processing disorder, Erlin syndrome, dyslexia, and more. Sharing her insights and understanding of neurodiversity has been the driving force behind her work, and she's also spent many years advocating for inclusion and educational reform. Her work as a neurodiversity advocate has been recognized worldwide, and in 2023, she was chosen as one of the top 50 neurodiversity evangelists by ND by Design, powered by Dynamis. She was born and raised in New York, yay, New York, and upon completing her studies, she made Aliyah to Israel, where she resides and is coming from today with her husband, children, and dogs. So, Ms. Jacky, I will turn it over to you. Thank you so much for being with us.
Thank you so much for giving me the opportunity to join you, and I hope that you'll find everything informative and interesting along the way. If you have questions, you can hold on a half a second. Sorry. Along the way, if you have questions, please feel free to raise your hand and we'll organize to have a question answer period at the end. Okay. So I'm going to share my screen right now and I'll take you through a bit of a presentation and then we'll go from there. Oh, wait a minute. Screen. Entire screen. Sorry, I'm having a little technical organizational stuff here because Zoom sometimes does funny things. So I will get that to go away. How do I get that? For all you Zoom people, do you know how to get rid of that little thing on the bottom there? I don't know. Oh, there it goes. Oh, I hope it doesn't bother us. Anyway, so this presentation is neurodiversity, autism, ADHD, sensory processing, and kids. Look at how the senses affect your child's sense of being, behaviors, and daily life. I'll tell you a little bit about me, even though I just had an introduction, so I'll do it quickly. But at the end of April 2013, I found myself waking up after brain surgery. I had a massive tumor on my brainstem, which affected every aspect of my life. And when I woke up, I found myself adjusting to a new reality, which was chronic pains and all different kinds of organizational things. And the one thing the doctors did not tell me was that I was going to have scrambled and distorted sensory and vestibular processing and perceptions. I had no idea where I was and how to make sense of my environment because everything was upside down, distorted, and unstable. So it was a very scary time, a very difficult time to try and readjust. I also had trouble speaking. I had difficulty connecting my mouth and my brain to formulate speech. So I did know what I wanted to say, but sometimes things would get stuck. To date, I do stutter sometimes. And being that I'm bilingual, I often have both languages that crash at the same time. So if that happens during this call, I just take a deep breath and be a little patient and it will organize itself. I learned to cope with that as well. And I couldn't organize my body to do simple tasks. So I would say, to walk or to do anything simple. To date, I still have problems organizing things from organizing both sides of my body, handing things from right to left, or doing something like yoga is practically impossible. But I slowly learned to compensate, and I can lead fairly reasonable motor and speaking and organizational abilities at the moment. So what happened to me as I become neurodistinct? Now, I was always a bit neurodistinct or neurodivergent because I had a very associative and logical thinking at the same time. I didn't enjoy studying in traditional environments. I did much better in alternative school settings where I could make my own program. I found that most of the time the traditional learning environments were not interesting, but it didn't mean I didn't have abilities. And these are things that are very important to understand. If you had kids that don't think in a conventional way, they might have difficulty in traditional educational settings, although they have lots and lots of abilities. So it doesn't mean the kid is a failure. I actually exceeded, but many kids have a difficult time in school and don't perform well if they don't think in a traditional way. And that's something to try and consider when choosing an educational program. So now I'm going to talk a little about neurodiversity. You can see on the side that's the neurodiversity is become a movement as well. And it has a symbol, that's a neurodiversity symbol. Sometimes you can see it in gold as well. So what is it? Basically, what it means is that we are all neurodiverse. Everybody has different brains. Everybody processes information differently. And it's what we are. All human condition is neurodiverse. What's neurodivergent or neurodistinct? And sometimes you'll see amongst the communities who are advocates for neurodiversity or autism, whatever they will call themselves, even neurospicy or interesting terms like that. But the usual terms you'll see are neurodivergent or neurodistinct. Those are neurotypes that are different from what is considered and accepted to be the neurotypical norm. I personally don't know exactly what neurotypical means because everybody is different, but there is sort of a standard that people expect for child development. And if somebody goes off that path in any way, or whether they excel or whether they have difficulty or challenge in any way, they will be called neurodivergent. Sometimes different neurotypes include things like ADHD, autism, sensory or auditory processing disorder, dyslexia, Ehrlich syndrome, and more. And oftentimes, people who are have differing neurotypes have different types of thinking as well. So sometimes, the traditional school is based on traditional logical thinking. Okay, one thing leads to another. But oftentimes, people who are neurodistinct have associative thinking. That means one thing can remind them of something, which can remind them of something else, and then something else. So you'll be on a subject, and then they'll start thinking, I don't know, about a lake, and you're teaching about a science class about lakes, and then suddenly that neurodistinct person will suddenly start thinking about the time he was up in the mountains and saw this beautiful lake, and then he went canoeing, and then suddenly within 2 minutes, they're thinking is a very different place. That's associative thinking. And then maybe the teacher or the parent will think, well, this kid's always off topic, but it's not necessarily off topic. What it means is they have a different way of thinking, and it's associative. And some people think in pictures. My autistic son thinks in pictures. So his first language actually is visual. And then he will translate in order to communicate to us, he will speak in words. But if he'll go to Google, let's say, and look up something new, he will look in Google Images first and then find the words for it. He thinks in pictures. And sometimes people have a combination of all of these different things at the same time. Am I speaking too fast, or are we okay? Okay, so here's a little bit about my family. Our oldest son is autistic. 2 of our children were mistakenly, and I will explain this in a few minutes, diagnosed with dyslexia and ADHD. when their accurate diagnosis was Irlen syndrome, auditory processing disorder, and sensory processing disorder. Again, I'll explain them all in a few minutes. But if somebody's senses are disorganized, the thing to remember is they're not going to be able to focus, which then can lead to a misdiagnosis of ADHD. My journey of healing from brain surgery and coping with severe sensory issues gave me significant understanding and insights about neurodivergence and sensory processing. What happened to me was I had been the parent, caretaker, I'd been a professional in the field, and then suddenly I was having all this stuff going on in my brain, and I started to understand what I had been observing all those years. And I'm happy to say that the way my understanding of it before as an observer was pretty on target, but still it's very, very difficult to try and imagine what it feels like to be in a person's body and brain that has sensory processing issues, because the reality is so very different from what we would expect. Irlen lenses, which is what I'm wearing at the moment. I have Irlen spectral filters. These are not sunglasses. They are lenses that are custom tinted for me in the color that suits my brain. And my kids have them as well. Change every facet of our lives and our well-being and our attention and just overall functioning. I'll explain about Irlen syndrome in a few minutes because that's very, very important. And as a parent, advocating for our children and coping with the educational system has probably been the biggest challenge for us throughout all the years, and the social welfare system. And we were in the States for a few years with my son. It was also difficult. It's just an ongoing struggle. I think probably for parents, and every parent that I know finds that the system makes it more difficult than actually dealing with the child's issues. You're just trying to advocate for them and get what they need, and it's just so difficult. And on the positive note, living with neurodivergence is fascinating. Never bored, ever, ever, ever. Colorful, creative, and in many ways, it's a tremendous gift. And really, our non-traditional thinking leads to a bunch of amazing things. So I see somebody's trying to enter here. Should I enter them? It's popped on my screen. Yeah, thank you. So the biggest thing that I came to understand about sensory perception and processing is that you can't argue with the senses. You just can't. Everything that we understand in the world comes through our senses. And you can't tell your senses to disregard something if you're getting too much sensory information, okay? You can't say to your brain, oh, it's too noisy. I'm just going to ignore that now because it's irrelevant. That actually doesn't work. You can't reason with them. Your senses will cause you to have a reaction, a physical reaction in your body, which you will have to somehow find a way to deal with them. And that's really, really important, especially when you see kids not wanting to go someplace or having a meltdown or things like that. It's usually sits on something sensory. So let me give you a quick overview of sensory processing. Everybody relies on the senses to process information from the environment. A neurotypical person has a series of automatic filters that prevent sensory overload. Pretty much we see and feel more or less what we expect to. And what does that mean? Let's say in our visual field, we filter out almost everything in our visual field that we think is unnecessary. Our brain just says, oh, unnecessary, we don't need to see that, okay? I remember there's a study a number of years ago done there in a pilot training simulator. They were training pilots to land, and they put a person in the runway, right? It wasn't a real one, it was a simulator. And the pilot landed on that person in the middle of the runway because they didn't expect there was somebody to be there, okay? So most of the stuff we see has is automatically filtered. And the same thing that happens in our auditory field. So if we're living on a busy street, for example, we won't hear most of the noise. We're used to it. After a while, you get used to it. You don't hear it unless there is an ambulance that goes by or a police car, and then you hear the siren and it catches your attention. So a neurotypical person can neutralize a lot of what's going on in the environment. Excuse me. Sorry. Now people can be hypersensitive, and they pick up everything going on around them, and their filters are busted, or they're super sensitive. Or they can be hyposensitive, and they're not getting enough stimulation. And so they seek sensory input. So if you get a child, let's say, that's all the time looking for physical contact and very can be rough and is or all different kinds of things to provide themselves with sensory stimulation. That's called sensory seeking or hyposensitive. Or they can be any combination of those two in any one of the senses. And another thing to know is that that can change every minute of the day. These things are not stable. So anytime, at any time of the day, depending on how tired you are or how much emotional stuff is going on, a person's sensory sensitivities change. Sensory processing issues are prevalent amongst autistic individuals and people diagnosed with Irlen syndrome, dyslexia, ADHD, auditory processing syndrome, which is called APD, and SPD, sensory processing disorder, and a whole range of other different things. But they're very common amongst people with different varying forms of neurodivergence. And a dysregulated sensory processing system makes understanding and interpreting the world challenging and at times very frightening. And that's something to keep in mind. Questions? Or are we doing okay? Okay. This is a very important thing to understand, particularly for educators. People with sensory processing issues have to work much harder than the average folks to achieve something or accomplish something. So if a child is in class or somebody in the workplace, and at 10 o'clock in the morning, they're tired or they don't want to make that effort, it's not because they're lazy. There is no such thing as a lazy child. What it is they're working really hard and their resources are already used up. And that's something that's not understood, and especially there are children that are recognized as having high cognitive abilities, but their performance is very low. There's something interfering there, and many times it's sensory. And if you can't say, the child's not trying enough, doesn't mean they're not trying. Something's interfering, and we, as people who work with these children, need to try and find out what's interfering and try and have ways to help them regulate that. And then they will have much more energy and cognitive resources available to do what you were asking them to do. Like I said before, you cannot overrule sensory stimulation. If we are overstimulated, it will automatically trigger the fight, flight, freeze response in a person. So let's say, I can tell you for myself, if there's a wedding or something, okay, and they're playing blasting music and there's or a concert and there's flashing lights, the whole body starts getting triggered as if they're under attack. It's releasing those chemicals that are made to protect us when they're feeling threatened. And you can't turn them off. You can't really, you just have to find a quiet environment and let the sensory system calm down, and that will solve the problem. If you get too much sensory information, you can have a meltdown. So if you know something is triggering, it's best to try and avoid them or accommodate for them, rather than trying to say, oh, we'll just keep putting the child in that situation. Eventually they get used to it. If you force them into it, like sometimes there are certain programs where you try and behavioral treat sensory issues with behavioral programs, and so they force the child to keep being exposed to something. The only thing that comes out of that, maybe the child will learn to tolerate it, but it will be with trauma, and actually it doesn't solve the problem. It just can cause trauma, so it's something to consider. Sensory overload is not a behavioral problem. and a reaction to a sensory problem is not because of behavioral misbehaving. It's because of their body's gone into fight, flight, freeze. Okay, now I'm going to go through the senses, each sense one after the other, and tell you a little about them. The most dominant sense that we have, which is about 70% of our sensory input, is visual. Visual perception and processing are neurological. It's what the brain does with the information picked up by the eye, which means that if it's a neurological or processing issue, the eye doctor will not pick it up. So if you're working with a child, or you're a parent of a child, or you know somebody that says, they can't read properly or something, and they take them for an eye test, and the eye doctor says, oh, there's nothing wrong, that doesn't necessarily mean there's no problem. That means it's not a mechanical problem. That means it's like the lens in a camera. The equipment works fine, but what's going on in the brain is the brain is doing something different with it. And that can be inefficient, or it can cause to visual stress, or it can do distortions or things like that. But it's not necessarily something picked up by an eye doctor. So my tip to you, if in any of the senses, if you think something's going on, the doctors don't find it, it doesn't mean it doesn't exist. You can recognize something going on. It means that they don't know how to test for it. And as a parent or somebody that's working with a child with things going on, the deal is to be sensitive, to observe and try and pick it up yourself. If you feel it exists, likely it does. And if the child says it exists, likely it does. Irregular visual perception and processing can be found in people diagnosed with dyslexia, Irlen syndrome, ADHD, autism, and other neurological differences. And vestibular stability is also affected by visual processing. If your visual field is not stable, your vestibular system works between a conversation in your brain between your eyes and your ears, the information that's being picked up in both senses. So if you don't have stable vision, it might throw off your vestibular system. And before I got my Irlen filters for 4 years after my brain surgery, I was walking with a cane because I couldn't stay on balance. And the minute my visual fields stabilized, then I was able to leave the cane aside most of the time, because the conversation between my eyes and my ears regulated for the most part. So I've mentioned Irlen syndrome a lot of times, and most people do not know about it. Irlen syndrome, it's sometimes called visual stress, comes from visual difficulty, a neurologically based difficulty, processing and perceiving visual information through inefficient processing of light, white light. Our brain does not break down the spectrum properly, okay? It could cause light sensitivity, visual stress, and problems reading, such as that may appear to be dyslexia. It can be genetic, and many times it is. I can say I have 4 children wearing Irlen lenses. I may have had it as a child because I had difficulty with depth perception. It affects depth perception. At night, my night vision wasn't good, but it was very, very mild. I was a bookworm. But I had 2 children that couldn't read, one in 11th grade and one they knew technically years of instruction, remedial instruction, but they could not read more than a few paragraphs because everything would start to move. What happened? They got lenses and they started reading. All the years of remedial instruction, suddenly in the test, suddenly I see my kid reading an entire page, without stopping in the middle and without spacing out and without having any difficulty. It was amazing. It was like a miracle. Like I said, not picked up by an ophthalmologist or in a didactic assessment. A didactic assessment will show you there's a problem, but it does not know what the problem is. And it can affect approximately 15% of the general population, 50% of individuals with reading and learning difficulties, 30% of individuals with ADHD and autism, and a significant portion of individuals with chronic headaches, brain injury, migraines. I can say there was a recent study in Israel that was done with college students diagnosed with ADHD, they used the Moxon, and they tested them before and after using Earlin spectral filters. And after they started wearing the filters, they tested normal. So that's something to consider. If I would, my recommendation, if anybody has any problems with reading, slow reading, or complains about light, to immediately get an Earlin test. My youngest child was tested in second grade, and he avoided all of the sorrow that my other kids had going through school, and the low self-image, and the kids picking on them, and all the other stuff, because they weren't academically successful. And because they had high cognitive abilities, they also knew there was something very wrong, and it was just absolutely traumatic. The minute they got their lenses, within a few months of practice, my kids were getting very good scores in school and feeling well, and tracking balls, let's say playing soccer, which they couldn't do properly because, and the thing about it also is that people who have it do not know there's something wrong, because that's a reality. They live with it. So they're not going to tell you they see something funny, because that's the way they always see. So only by observing them or taking them for an Earlin test, you can figure out that that's the problem. It's a simple two-part assessment. Visual issues corrected with colored spectral filters or sometimes overlays. A large part of the medical industry and the educational industry does not officially recognize it, although there have been many, many studies. Here in Israel, educational bodies do not recognize or suggest screening for this common problem, unfortunately, because so many kids are misdiagnosed with ADHD and dyslexia when it's actually a visual problem. And colored lenses can be life-changing, as I said. They create a general feeling of well-being, prevent educational failure, and save a tremendous amount of emotional pain. I know that they gave my life back to me. I had such severe visual distortions, and I went to a neuro-ophthalmologist. I went to eye doctors. For 4 years. I would look at somebody's face and it would melt. This is something, let's say, with autistic kids and eye contact, because if many of them have Earlin, and if you see a kid avoiding eye contact, if I can say that if I was a child, I'd probably be diagnosed autistic, even though I am not, just because of my sensory issues. But as an adult, I would look at somebody's face, and in the middle of a conversation, it would start melting, which is a terrifying thing. I knew better that my brain was playing tricks on me, because I was an adult and had previous experience. But if I had been a child and I had experienced that, I would never want to look at somebody's face, because it was terrifying. So if these kids have problems with eye contact, you should definitely check their visual field and Earlin to make sure that's not the issue. Questions? Okay? Doing okay. Auditory processing. Auditory processing is very similar to APDs, or similar to the Earlin of the eye, of the ears, okay? It's what your brain does. A hearing test can be normal, in normal range, okay? Often it's spiky, but it's in normal range. But if you do an auditory processing test, it can be very severe. My kids tested normal range, and one of them is wearing a low gain hearing aid now, and which has completely changed his life. And he can now follow conversations, which he could not do beforehand. It causes often coexists with ADHD, autism, APD, Earlin syndrome, many, many times. All these processing issues, they come together. It affects the ability to process speech, and many times one can note irregular speech, or missing parts of words, or incorrect pronunciation. Or let's say you tell a child, go bring something from the bedroom, right? And they go happily because they want to do what you want them to do, and they come back with something that sounds similar. That can indicate an auditory processing problem. And they can have difficulties filtering sounds. So in understanding speech in a noisy area, like a classroom or a restaurant, is a problem, or they can have sound sensitivity. These things make life very, very difficult. An acoustic classroom in schools can help significantly, and there are assistive devices that can also help. It's exhausting to understand speech with an APD. And as the day goes on, it gets more difficult. reading can help clarify pronunciation. Before my son's hearing aid, and when he was young, I don't think he understood anything. I'll reiterate, it's a low gain hearing aid. It's a regular hearing aid with special programming. Not every audiologist knows how to do that. And there's a doctor, Dr. Ray Stout. She has a huge Facebook following for auditory processing. That's how I found out about these hearing aids, and I had to look far and wide in Israel for somebody that could help. Anyway, he couldn't understand what we're saying, and then we taught him to read, and then when he didn't understand something, we would write to him, and he was able to know what we were saying and pronounce correctly afterwards. And reading lips helps. And here's where the misdiagnosis of ADHD comes in when you have an auditory processing problem. Let's say you're sitting in class, okay, and you miss the key word in a sentence, okay, or every few sentences, you miss a word or two. So you're sitting there and the teacher says something and you miss the key word, and you're cognitively focused. So you say, okay, I'll try and figure out through inference what the teacher says. So you kind of zone out for a second to try and understand what the teacher says. You get the word, and then by the time you zone in, the teacher's already continued speaking another 2 or 3 sentences. And within 15 minutes, you have no idea what's going on in class. And so you start to zone out and space out and think of other things and daydream, and the lesson goes away. And the teacher says the kid's not paying attention to anything. And then the parent goes, okay, I'll go to the neurologist. And the neurologist will say, okay, yeah, problem concentrating in school. Let's do a test. Again, the kids may have Ireland with that as well. And within a very short period of time, that kid is diagnosed with ADHD. They suggest a Ritalin and things like that. But the problem actually is sensory processing. So sometimes the Ritalin will make the child sit, but it does not solve the APD. Therefore, the way to solve it is to try and think of assistive technology, low gain hearing aids, acoustic classrooms, and everything else you might use to help sort out the auditory processing issues. And again, you need to ask for a specific test for auditory processing disorder, not the regular hearing test. Quickly through additional senses: tactile, gustatory, and olfactory. Tactile could be don't like being touched, wearing itchy tags or uncomfortable clothes, experience irritability or pain from touch, which can cause problems in school. If a kid's in a crowded classroom, a kid goes by next to them, the backpack of that child brushes that child, the child will think that kid just hit me, get up and whack them, and there you go, you had a fight, just because the children has tactile sensitivity. That can be assisted by moving the child to a little bit away so that these things can be avoided. If a kid has itchy clothes or doesn't like what the fabric is, then let them wear comfortable clothes, because if they're in uncomfortable clothes, they will not concentrate the entire day. So these things, you shouldn't be fighting with them. Just try and find things to neutralize the sensory hypersensitivity in order to enable to free up their cognitive and emotional resources to learn and do. Gustatory, picky eating, aversion to textures and mixing foods. This is a big one. And many times parents or caretakers have problems with their child that are picky eaters, and they argue with them, and that can cause eating disorders. What I used to do, which I found very helpful, is I suggest that I used to just, my autistic son ate about 5 things until he was maybe 12 or 13. He was very, very picky. I just used to leave bowls of different things all around where he's playing or we're doing, and eventually he would touch, taste, and now he eats everything as a young man. But it took many, many years, but to avoid fighting about it, because if food becomes a power play in a fight, nobody wins. And olfactory, if a person can be sensitive to a perfume or a strong reaction from smells, foods, whatever, that can also they can get a headache, they can get nauseous, they cannot be able to learn or concentrate. So if the person has a hypersensitive olfactory sense, make sure it's a ventilated place, move them away from sitting next to the lunchroom, and all kinds of things like that. How are we time-wise? Marcy?
Sorry, I was
How are we
having a little
time-wise?
trouble getting off mute. We are at 12:36 and you have until 1:30, so we are good.
Okay. So I'll go back on, imagine how a sensory load. These things I said before. Imagine that you're having a hypersensitive day, okay? And you see everything going on. There's lots of, you're in a classroom, there's lots of stuff going on. Kids are moving around, they're throwing paper balls, they're doing all kinds of stuff. There's a lot of stuff written on the board. The light's too strong, and your visual sense overload, you're starting to get a headache and see things a little bit blurry. And then your auditory sense gets overwhelmed, and you can hear everything, the wind in the trees outside, the kid tapping on their pencil, the kid banging their foot, somebody moving up in their squeaky chair, the air conditioning is making too much noise. Imagine your body starts to get really, really, really stressed from all this stuff going on, right? And you're trying to calm yourself, but you can't because there's too much information coming in. And at the same time, the teacher asked you to do a task. Write this down, fill in this workbook, do this, whatever, or ask you a question. Would you be able to do it? Would you be able to do it efficiently? How long would you be able to do it for? How long can you concentrate for? What happens after you have 4 periods of this going on? What happens by the end of the day? How would you feel? That's my question. And then if the teacher sees somebody like that and says you're being lazy, try harder, or the kid says, I gotta go to the bathroom, even though they went to the bathroom 15 minutes ago, or I gotta get up. Why is that happening? What can we do? How can we help that child? Don't assume the kid isn't trying. The kid is trying. They're trying really hard. If the senses are overloaded, all the cognitive resources are going to be blocked. They will not process. If a kid can't process what they're reading, then what's going to happen is there will be decoding and they won't remember anything that they read. Even if they read it out loud, they won't remember anything because their cognitive resources are busy decoding. Same thing happens in the auditory sense, and if you got a bunch of them together, it's really rough. And if you shout at a person with sensory overload or punish for it, it makes it far worse. Okay? It's not, it's so important to try and understand what helps. Shouting doesn't help. Providing a calm environment will help. Giving a break helps. A walk outside, a breath of fresh air, something to drink, quiet. Forcing a person to stay in an overloading situation can cause trauma and emotional damage. I cannot tell you how many autistic adults I have met, particularly those who have experienced behavioral, like ABA behavioral treatment for sensory things, that have post-trauma now, and it is just so sad. So if everything gets overloaded and the system goes into a meltdown, then you just have to help the person calm down. No, there was always a reason for a meltdown, even though you might not understand it. If somebody made me go into a wedding where there are lights and flashing noise, or a shopping mall, and I was a child, I would have had a meltdown. I would be kicking, screaming. I would do everything not to go in there because it would make my system go on fire. And now, as an adult, I will not go into a place like that because I know what's going to happen to me. I can do much better now that I have ear lenses and I put in earplugs, soundproof earplugs. So now I can function in most places. But without those things, you feel like you're in a war zone. You're under attack. There's always a reason for a meltdown, even though it doesn't seem like there might be. And it is not a behavioral problem. What it is like an electrical current that runs through the system, and it's too much, it's a surge, and then the circuit breaker would trip. We have a meltdown going on in our brain, our circuit breakers trip. So as somebody that's observing a person with a meltdown, try and figure out the trigger. What happened? It's usually sensory. What happened 10 minutes before, 5 minutes before, 2 hours before? What time of the day is it? Try and log, take an account of everything that goes on before the child melts down every time, until you try and suss out what the triggers are and then try and accommodate for them. and try and avoid them before the next time. And if there's a meltdown, a person needs a quiet space to regulate themselves. Only afterward you can discuss it with them. I can tell you that I was cooking in the kitchen a couple of months ago, and my kid started playing music with a boombox. And I'm thinking, okay, he's in the kitchen too, and he's got to cook something. And I have 10 minutes to go. I can handle this. I told myself I can handle this. And within 5 minutes, my body was shaking. I had so much adrenaline in my body, I had to go to my room and sit there for 2 hours. That's what happens when the body goes to a meltdown state. Marcy, are there, or Beth, the audience, will there be people that need to know about speech and communication, do you think? Because I'm running short a little of time, so I want to know what to concentrate on.
I think certainly the folks can put in the chat whether or not they need that information. So our
Okay, so let
audience,
me know after. I'm going to go through it quickly, and if there are questions.
they said yes, please, in the
Okay,
in the chat.
okay. So there are many different types of communication. Formulating speech is extremely complex, involves thought, motor coordination, and all. It's probably one of the most complex things people can do. Okay? If something is off in any of those connections, person may understand everything going on and not be able to put their mouth in gear. Okay, that happened to me. And then I went to a neurologist with my husband, and the neurologist is sitting next to me and says to my husband, was she like this beforehand? I mean, I couldn't, I knew what I wanted to tell him, and I actually wanted to hit him with my cane, but I couldn't. But you have to make an assumption that the person you're speaking to, even if they don't speak back, assume they have competence and they understand. And the very important thing to understand about that is never say anything negative about the person or the child. This happens all the time in schools, professionals, next to the kid who's, especially if they're nonverbal, don't say anything bad about them next to them. Do it in a professional setting, because if they hear and understand, they're going to be hurt, and they might not be able to tell you what they're thinking or feeling. So don't do that. I can't tell you how many times my child, he's not very verbal now, and he was nonverbal until he was very small, short sentences until he was about 13. How many times I saw his eye flinch when he heard those things being said around him, or what's wrong with him, or he's this or that. And I always tell people not to do that, but it often happens as you walk into a doctor's office and it happens. Try and avoid that situation. As a parent, I would say, we'll talk about it when he goes with his dad out of the situation, out of the examining room. I'm not going to let him hear all this stuff. Please take care about that. Talking on the phone, they may be listening and hearing everything. Be careful. And as best you can, try and help people who are nonverbal or minimally verbal, help in the decision-making process. Give them two choices and let them pick even if they're pointing. Different ways of expression don't mean the person lacks feelings or emotion. They may not be able to tell you, but that doesn't, or they may express things differently, but that doesn't mean that, I firmly believe that no matter what the technical difficulties are, the inner core is like everybody's the same. We all want love. We all want respect. We want people to understand us. We want to express ourselves, but we may have technical difficulties that prevent us from doing those things. And if you assume that, and you have hope that things are going to get better, and try and be creative and not say, the child's pointing, don't say, that's not communication. Let's, you have to do this. That's what communication is. No, if it's any communication is communication, try and understand there are different ways. Now, my son, he communicates a little bit of verbal. I found it fabulous. We work with him a lot. He writes back in the chats, and with pictures and all different kinds of things, all different forms of communication, and they're all valid and they all help. I said before, some people think of pictures, not words, which slows down communication. If you think in pictures and not words, they have to sort through all those photo libraries and movie libraries in their brain. It would sometimes take him, by the time he processed auditory stuff and went through the pictures and then was able to engage his mouth, it would sometimes take him a minute to respond to something. Now, by that time, the person who's waiting for him has probably asked him 5 times and assumed he doesn't know what you're talking about. But that wasn't the deal. It was just getting everything going. So augmentative communication can help with people who have that sort of problem. And now that there are cell phones with chats, they don't even have to walk around with a big iPad. A lot of people can look like everybody else if they don't have to stand out, even if they have these issues. Always ask the person if they can tell you how they prefer to communicate. If they have an APD, then they might prefer to communicate by emails instead of communicating again, understanding things said in a meeting. If they have the ability to tell you, ask. Another important thing is talk regularly and interact at an age-appropriate level. Do not infantilize. Kids nonverbal, you think they don't understand, talk to them like a baby. You don't say to a 13, 15-year-old kid, oh, you're so cute. That's what you may say to a 3-year-old, but don't do it to someone who, and then actually I know a lot of physically handicapped people in wheelchair that people also assume they have cognitive impairments because they look different or they sit in a wheelchair. Everybody assume competence, everybody talk to them at age appropriate level. And if they don't understand, then you can find other ways, but assume that they can. Another thing about an APD is that people don't realize how much language they miss. So you need to ensure they understand you. They think they got it, but they don't. They don't know what they're missing. So if you think they didn't get it, then you find a different way to communicate what you're trying to communicate, or write it down, or ask in a different way, and you make sure it's on the person trying to communicate with them to help them understand what they're missing. Reading lips helps. Reading and messaging help facilitate understanding. Okay, autism. My view of autism is a little bit different than a lot of people's. I do not speak DSM here. I speak mommy, I speak sensory, I speak all the different things in my experience over the years without looking at all these pathological diagnostic criteria. I also know many, many, many autistic individuals from all around the world that I've met over the last number of years. And every person looks completely different. If you put 20 people with a diagnosis of autism in the same room, you will not know why they have the same diagnosis. So I prefer to leave the diagnosis aside and look at the person and see the person before the diagnosis. Autism is a different neurotype. It's not a disease. It's not something to be eradicated. It doesn't go away. You can improve quality of life. You can help improve communication by providing things that are helpful, but it's not a disease. And so there are many old organizations years ago that would consider it as something, a horrific disease to be eradicated. And many, many people who I have met over the years have been hurt by that sort of mindset. So please, it's just a difference. Autistic individuals perceive and process information differently than neurotypical people. Sensory processing differences play a significant role in autism. Oftentimes, autistic individuals have difficulty filtering or regulating sensory stimuli, and this needs to be understood and accommodated by those around them. Something to understand about stims, okay? Stims, self-stimulatory behavior, stims, things like flapping, rocking, all kinds of things like that. They are not behavioral issues to be eliminated. They regulate the system. The need as a system regulates, the need to stim decreases. I can vouch for this. I remember, and this was very interesting, that I had my vestibular system was off after my surgery, and I felt like I had a weight of 50 pounds pushing me to the side. And the only thing that would help me to feel like I was standing up straight was to stand and rock. And so I found myself in the kitchen standing there and rocking. And I'm thinking to myself, gee, if I was an autistic kid, they would tell me that that's inappropriate behavior and they would try and make me stop. But my physical therapist, who did not work with autistic kids, said, hold on the chair and rock back and forth. It will help you. And I started laughing. I said, see, she understands it, but I don't know why many people don't get it. All stims help people to regulate. That is the way they regulate. And if you eliminate them by behavioral treatment, oftentimes, and I remember when I worked in an ABA school for a period of time 30 years ago when it was just starting, they used to complain that you get rid of one stem and another one comes in its place. And actually, The reason it comes in place is because it's regulating the system. If you just leave it alone, doesn't mean the person's not listening, doesn't mean the person's not with you. It's calming the system so they can connect to you. Don't make it go away. That's my personal opinion and my personal experience. Again, you can take it as you wish, but that's what I have felt and learned and seen over the many, many years I've worked with autistic individuals and the many that I know from around the world. Something that's different from what was told to me when my child was young is autistic individuals have the potential to live a satisfying life. They have unique perspectives and talents that can be beneficial in the workplace. Their use of language and ways of communication different from those of neurotypical. And many autistic individuals need assistance to develop effective communication skills. Some will need augmentative communication devices. And they can empathize and develop loving relationships. In fact, so many of them that I understand are so empathetic that they have to turn off some of their emotion because it hurts too much. And that's a very common theme that I've seen and experienced. A bit about ADHD. According to CDC, over 6 million children in the US are diagnosed with ADHD. 62% of them are treated with medication. 47% receive behavioral therapies. Many instances, I said before, sensory issues can appear to be ADHD, particularly those involving visual and auditory perception. Sensory issues should be addressed before considering other forms of treatment. Try and rule out all the sensory. Take them for an Earland test, APD test, before trying medication, because it might just solve the problem before the child has to go through dealing with the side effects of medication. Individuals diagnosed with ADHD will need to learn skills and techniques to help them learn to stay on track and get organized. Particularly, I found time management is one thing that really should be, there's so much assistive technology that can help in that, but that's a real problem with people with ADHD. Time, I think we need to.
We are at 12:55, so you have about 35 minutes.
Okay, so diagnosis. You need diagnosis to receive services, but it usually doesn't give you too much info about the person. You'll say ASD, APD, ADHD, blah, 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 blah. What does that tell you? What it tells you is you need to observe them, interact with them, and try to figure out how to help with them. That's what the need is. It doesn't really give you any information. What it gives you is guidelines, and what it gives you is eligibility for services. So always see the person before the diagnosis. I've heard parents say stuff, oh, that's my spectrum kid, that's my this kid. Those words are irrelevant. Look at the person, see who they are, and then try and figure out how to connect with them, how to communicate with them, certainly love them, and you'll go far. The diagnosis absolutely does not define the person, and do not start looking at the person and try and see how the behavior they do fits into the diagnostic category. Oh, this because he's blah, 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 blah. And remember that the same person is the same person you love before and after the diagnosis. So if a person is diagnosed with autism, then they're autistic. They were autistic before the diagnosis. Love them the same. And don't let the diagnosis limit or define anything. And don't let the professionals who are going to tell you that that child is going to be limited because of their diagnosis. Do not believe them. The person that told me, the very famous neurologist in New York, who saw my child at age 4, who was nonverbal, and said, well, if he hasn't started talking by now, he's never going to. He was wrong. The next day, my child said, Mommy, on his own. Who are these people to tell you what's going to be your child's future? Nobody is God. They do not know. We need to understand. We need to work hard. We need to do everything we can, and always believe that things can get better. So if you get a diagnosis, take a deep breath. Don't try to figure out why it happened. Oh, it's because this one did that, or it's genetic, or just focus on where it can go moving forward. Everyone goes through a different coping process. Some people will get sad, or they'll mourn that, oh, this child will not be what I dreamed, they have the same future I dreamed for them. Another parent will say, okay, that's fine. Another parent will go, oh, I need to know everything I can. We'll get all day. They'll join every group on the internet and read everything they possibly can. And everyone deals in a different way. And we need to be patient with each other as parents, that everyone has a different coping process and they're all okay. So you need to seek to support each other and not blame each other. Unfortunately, people go through crisis, if things are not as they expected them to be, and that often causes a lot of strife. Do not assume your child or family will have a bleak future. It's going to be different, but it's not going to be bleak. And have hope. It will keep you motivated. If you don't have hope that things are going to get better, it's going to be really hard to get through those difficult times. And there's going to be difficult times. Life's going to be a roller coaster, and you're going to have a lot of challenges. But have hope. It will keep you going. So hope is because brains have plasticity. And you can see now, many years ago, they thought brains, did not have plasticity. And if you didn't solve all the problems by age 5, that was the end. I can tell you, I've seen many, 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 many miracles. People of all ages, no matter where they are. Professor Reuben Feuerstein, blessed be his memory, used to talk about this all the time, that no matter where you are, what state you are, you can always improve. And I have seen it. I have seen it so many times. I have seen people who've been injured in terror attacks, and their brains have been blown out of their head or part of their brain, and they have learned to talk, and they have gotten married, and they have had families, and they have learned to do everything all over again. Brains have incredible plasticity if you work with them. At any age, new connections are formed every day, all day. I know a person whose speech center was blown out of their brain, and they learned to speak 2 languages. People can always improve. Cognitive and emotional building blocks take a long time to become established, but once they're in place, progress is limitless, sorry, which means that you don't have to rush to see those changes. They happen slow. You keep working. As long as you see progress, keep going. If it works, you don't have to change the whole program because it's not happening fast enough. If you see improvement, you're doing something right. And don't believe anyone who tells you otherwise. Progress should always be measured individually. Don't compare your child to the other kids in class. If they're moving forward, if they're improving, you're doing something right, keep going. I had school people, so my child was an inclusion. They said, he's more than 2 years behind the other kids. He's not in comparison to them. He's not progressing. I said, I want him here. And he just kept improving. He just kept going. Sometimes your parents are going to have to fight and advocate for that. But you check, see if your child is improving. Keep doing what you're doing. Assistive devices and technology can help people express themselves and progress. I've said this before, and I'll keep saying it. Find any way to help people communicate. It improves everybody's life. Keep in mind, special children have a special mission. Everyone has a unique mission and can contribute something, even with differing abilities. Special children will achieve different goals than initially anticipated. This isn't necessarily negative. They'll teach you things to appreciate the things you might have taken for granted. I know at age 5, when my child said, Mommy, I cried, because that's a miracle. And I've seen miracles all through the years. Most people don't have that opportunity to recognize and appreciate those miracles. If you're a parent of a special needs child, you will get that opportunity, and you will love it. Your family balance will change if you have a autistic or neurodivergent child. You do your best, and don't beat yourself up about it if you can't do more than you can. You have limited time, finances, and emotional capability. Back about the negativity, don't say anything negative about your child around them, and they understand. Don't overschedule. Some people think they need to be scheduled from morning to late at night, and any downtime is a negative thing. But most of us, at the end of the day, at the end of a school intensive program, that child's going to be tired. Most of us want to play on our cell phones or kick up our feet. They do too. Doesn't matter what the diagnosis is. Teach to enable, teach them abilities. It takes a long time to teach a child to button their shirt or make their sandwich or tie their shoes, but in the end, they'll be able to do it by themselves. And that's what we want to do in teaching. And very important advice, have a sense of humor. Humor is priceless, makes us feel good, and helps us get through the day. And have fun and enjoy life and your child. I think we're out of time for school system. I want to leave time for questions, although you can read this. Maybe leave it up for a second, and then people can read it. Yes, unless people want otherwise. Tell me when to go on. Okay, next screen.
Yes, that's fine.
Okay, just one more time. No such thing as a child who's lazy who doesn't want to succeed. That creature does not exist. Everyone wants to succeed. Neurodivergent kids work much harder than neurotypical kids. They need to be frequent breaks and ways to release steam. Teachers need to understand and accommodate this. And people will usually need downtime after school to rebalance. These are things I said before. I'm just leaving up the screen for a second so you can read it later on if you want. Parents are made to often feel guilty if they do choose to not medicate their kids. I do have to say that's happened to me and many people that I know. Try sensory things. And if you do not want to medicate your child and you've done these other things, you are not required to do that. You know your child. Quick recap. We all are neurodiverse, and that's how we're supposed to be. The environment must be adjusted and accommodations must be made for neurodivergent individuals. Always assume competence and make accommodations when necessary to enable the neurodivergent individual to thrive, prosper, communicate, and feel comfortable in a sensory environment. Neurodivergent individuals work much harder than neurotypicals in every environment. It's important to recognize these efforts. Neurodivergent individuals contribute incredible things to the world. Temple Grandin, one of the most famous autistic individuals, and if you have not read anything about her or seen her movie about her, check her out. She said the world needs all types of minds, and I agree with her 100% about that. And neurodivergent individuals are different, but not lesser than neurotypicals. Moving forward, there are times we must readjust our expectations in our lives and families. Keep in mind, challenges are also opportunities for growth. Some days will be easy and others quite challenging. And when black clouds appear on the horizon, simply recognize they exist and say, okay, move on. They're going to come and they're going to go. Busying yourself by doing good and trying to help the world, make the world a better place, brings happiness and meaningless to life, especially in the face of challenges. That's my tip. That's what I try and do. And it gives me a lot of meaning. Surround yourself with positive people and true friends. Remember that we all have a mission to fulfill and a purpose in life, including neurodivergent individuals. Life isn't always about achieving everything or being perfect. Achieving happiness when goals are reached. It's about growing throughout the journey and appreciating the good things we have around you. And a positive mindset will give you the strength to wade through the challenges. It helps things to take things one day at a time. Appreciate the good, and at the end of each day, say thanks for all the positive things, as small as they may be. Before I close my eyes on that pillow every night, I say, thank you for giving me the ability to do whatever I did today. I don't know, even if it's being able to get out of the bed and walk 5 steps, whatever it is, find a list of things to say thank you for before you fall asleep. It'll make you feel great, and you'll wake up different tomorrow. And there'll be ups and downs, and you need to go with the flow and have hope and never give up. And remember, life's a blessing, a tremendous gift from God, and I guess that's the most important thing I could say.